Okay, so good morning. Today we are going to talk about viral diarrhea or viral gastroenteritis. Okay, so most of the acute infectious gastroenteritis worldwide are caused by viruses only, and viral gastroenteritis most commonly occurs among children. Okay, though person of all age can be affected. Now the most important virus which causes these viral diarrhea is rotavirus. So this PPT is basically on rotavirus only. Other than that, we will talk briefly about the other viruses which causes diarrhea. Okay, so this is the basic overview of the slides which are to come. Okay, so first we will see rotavirus, which is a segmented double-stranded RNA, and the gastroenteritis feature which we can see in that is group A is the most common cause of severe endemic diarrheal illness in children worldwide, and there is other group known as group B which causes outbreak of diarrhea in adults in China only. Okay, then we come to Kalisi virus. Okay, don't confuse with Game of Thrones. Okay, Kalisi virus is there are two types. There are two medically important virus within this, which is norovirus and sapovirus. Okay, both of them are single-stranded RNA viruses, and norovirus causes outbreaks of vomiting and diarrheal illness in all ages, especially older children and adults. And sapovirus causes sporadic cases and occasional outbreak of diarrheal illness in elderly patients and also young children. Then we come to astroviruses, which is again single-stranded RNA virus, which causes diarrheal illness, which causes again sporadic cases and occasional outbreak of diarrheal illness in case of children and your adults. And then is adenovirus, which is type 40 and type 41, which is double-stranded DNA virus. It is the second most important cause of viral diarrhea. And it happens in infants and young children worldwide. Okay, so the most important cause is your rotavirus, which was your segmented double-stranded RNA virus. Second is your adenovirus, which is type 40 and type 41, which will be double-stranded DNA virus. Okay, so these both are double-stranded. Other viruses are single-stranded RNAs, which include norovirus and sapovirus within Kalisi viruses group, and then there is astrovirus. Okay, so first let's talk about rotavirus here. So rotavirus, as I already told, is the most important cause of diarrhea in children. So first we'll talk about size and the symmetry. So the size will be 60 to 80 nanometer in size, and they possess a icosahedral symmetry. Now the peculiar feature about this virus is they have a three-layered capsid. Okay, so there is three-layered capsid, and they possess segmented double-stranded RNA, which are 11 segments are present. Okay, and when we talk about protein, they have 6 structural proteins and 6 non-structural proteins. And the structural proteins, we have VP1 to VP7, which except VP5, and under non-structural proteins there is NSP, that is non-structural protein 1 to 6. Okay, and this VP6 is group specific, while VP7, which forms the outer capsid layer, and VP4, which forms the spikes that emanate out of the outer capsid layers, these both are your type specific. Okay, that means they are strong inducers of neutralizing antibodies. So this is the structure. So you can see this is your outer, this is your intermediate, and this is your inner layer. Okay, so there is three-layer capsid, and and there is VP7, VP4, which is present in the outer capsid. Intermediate capsid has VP6, which is your group specific, and inner capsid will have your VP2. Okay, now how are these viruses classified? So first of all, they are the only viral family which has your double-stranded RNA. Okay, so classification can be done in two types. There can be traditional classification, making traditional groups. So that is based on your antigenic composition of the group specific VP6. Okay, so based on VP6, it is divided into 7 major groups, which is from A to G, and the most important which causes diseases, viral diarrhea, is group A, and to a much lesser extent group B and group C also causes this diarrhea. And then there is your binary system of typing, which is based on your VP7 and VP4. VP7 is a glycoprotein which is of which or a G type of antigen, okay, and VP4 is a P type antigen or proteins or protease sensitive protein, okay. So both serotyping and genotyping can be done by this binary system of typing. So so based on VP7, it is divided into serotypic numbers like G1, G2, G3, etc. And in VP4, like genotype format is routinely used for typing of VP4, and that is denoted with brackets. So here, as you can see, P1, P2, where 2 and 1 will be in brackets. Okay. So the most widely used format for expressing rotavirus type in combination of G serotype and P serotype. Okay. So if you want to express the rotavirus type, you are going to say it is just G1P8 type. So this G1P8 is the most common type which is seen, and it nearly 70% of the total isolates of rotavirus is your G1P8 type. Okay, so currently 19G and 28P types are known. Okay, and whenever you are expressing a rotavirus type, the combination of two must be there. Now the diversity among the rotavirus type is more commonly encountered in area with poor hygiene. Okay. Now we come to pathogenesis. So rotavirus infects and ultimately destroy the mature enterocytes in the villi of the proximal small intestine. However, gastric and colonic mucosa are spared. So proximal, so in the villi of the, so suppose this is your proximal small intestine, okay, and here there will be enterocytes, okay, which will have villis. So this is your one enterocytes. So like that, there will be several enterocytes will be there. Okay, so this is your proximal small intestine. These are your enterocytes which has villi in it. Okay, so where does rotavirus multiply? They multiply inside the cytoplasm of this enterocytes and damage the transport mechanism, resulting in secretory diarrhea. So here there will be your there are so many channels for electron channels that is only disrupted inside the cell. Okay, and who does the disruption? It is the enterovirus which is produced by these rotaviruses. So non-structural protein NSP4 acts as an enterovirus which induces secretion by altering epithelial cells functions and permeability, leading to damage in the transport mechanism. Okay, so damaged cell then these cells will get damaged due to wrong transport mechanisms. Okay, and due to which these damaged cells are going to sog into the intestinal lumen. So this is your intestinal lumen, right? And release virus into the feces. The count may exceed up to 10 to the power 10 viral particles per gram of feces. Okay, so from here the virus and all the damaged cells is going to come out, and it is going to go through your intestinal lumen and then excreted as feces. And so viral load is very much higher viral load is seen in feces of the patients which are infected by rotavirus. Okay, so viral excretion usually lasts for 2 to 12 days, but may be prolonged if the patient is on poor nutrition or is HIV infected. Okay, so this is your overall picture. Now we come to clinical manifestations. So incubation period of rotaviruses is 1 to 3 days. So it is abrupt onset. It is generally a abrupt onset and characterized by vomiting followed by your stomach ache, watery diarrhea and fever, abdominal pain. And recovery usually occurs in majority, but few children may suffer from severe loss of electrolytes leading to dehydration. Okay, so these are common things. So infected adults are usually asymptomatic, but they show seroconversions. However, epidemic and large outbreaks have occurred in adults, especially in closed population. Okay, so here important thing is infected adults are usually asymptomatic, but can show seroconversions. Okay, now group B rotavirus, as we talked in the earlier overview, that chart. So group B rotavirus have caused a large outbreak of severe gastritis in adults in China. Okay, so it has caused only in adults, group B. Group A generally causes in children and older males. So these are the symptoms which you can see in a rotavirus infected patient having viral diarrhea. Okay, so generally they are children which will have your sunken eyes and cheeks. They have decreased skin turgor, they have sunken abdomen, they have dry mouth or tongue, and few or no tears can be seen. So all these are the symptoms of the disease. Now we come to epidemiology. So epidemiologists, rotavirus are the single most important cause of gastroenteritis in young children. Okay, young children. So worldwide, 3 to 5 billion of diarrheal episodes occurs in children annually, out of which 1 million dies. Okay, especially in your sub-Sahara Africa and your Southeast Asia and Southern Asia and Sub-Saharan Africa. So in developing countries like India, rotavirus illness occurs at a younger age, is less seasonal and more frequently causes a diverse and uncommon serotypes. Okay. So whereas in temperate climate, group A rotavirus causes the outbreaks in cooler months. Okay, so this is what comes under epidemiology, not that important for you guys. Okay, now we come to lab diagnosis. So in case of bacteria, if we want to see a bacteria inside a microscope, we will do gram staining, EFD staining, etc. If you want to see a virus inside under a microscope, you are going to perform your immunoelectron microscopy. Okay, so that is very important. Like in the lab diagnosis of bacteria, the first thing that we do is gram staining. Here the first thing which you are going to write or which you are going to see is your immunoelectron microscopy. Okay, so first of all, the sample, what will be the sample collected? Stool. Okay, so rotavirus can be demonstrated in stool. So fresh stool is the recommended sample. So first thing we are going to do is direct detection by immunoelectron microscopy, where we are going to see rotavirus as sharp-edged, triple-shelled capsid looking like a spokes grouped around the hub of the wheel. Okay, so this is how it will look like. So spokes grouped around the hub of a wheel. So wheel-like appearance rotavirus has. So isolation of these viruses are very difficult. So rolling of tissue cultures is attempted to enhance the replication. Then we come to detection of the viral antigens, which we do by ELISA and latex agglutination test based methods. Then RT-PCR as so the main demonstration of virus which we can do is by RT-PCR only, real-time PCR, or here there is reverse transcriptase PCR. Then it is the most sensitive detection method for detection of rotavirus from stool. Then typing methods, as we already talked about, there is G serotype and P serotype, VP7 and VP4 of rotaviruses can be detected by RNA sequence method and neutralization test respectively. And then serotypic tests, other serotypic tests like ELISA can be used to detect the rise of antibody titers. Okay, this is which is essential to get the seroprevalence of a community. seroprevalence of rotavirus in a community can be detected by doing ELISA and detecting the rise in antibody titer. Now treatment, there is no such treatment. Treatment is basically supportive. Okay, so the loss of water and electrolytes is corrected by oral and parenteral fluid replacements. Okay. Now we come to prevention. So under prevention, there is one human live attenuated rotavirus vaccine available, which is known as Rotarix. Okay, it consists of live attenuated human strains of rotavirus serotypes G1, G2, G3, G4 and G9. Okay, the schedule is you have to give it through oral route, and there are 2 doses, one in 2 months, first one is 2 months and the second one is 4 months after birth. Okay, now there is one most serious complication which is related to this rotavirus vaccine, which is known as intussusception. Okay, in this what happens, suppose this is your intestine, and a part of the intestine sometimes telescopes itself into the former part. Okay, so this is how it looks like. So this is your ileoileal intussusception, and this is your ileocolic intussusception. Okay, so this part is getting telescoped inside the your small intestine, inside the other intestine. Okay, so that is known as intussusception. Okay, so general preservative measures to improve hygiene and sanitization are necessary for the prevention of this infection. Okay, so this is also your major point in prevention, in the preventive measures to avoid viral diarrhea. Okay, now we come to the other agents of gastroenteritis other than rotaviruses. Okay, so after rotavirus, there was this family known as Caliciviridae. Okay, Caliciviridae, they comprise of 4 genus, out of which 2 are most important, which are your norovirus genus and sapovirus genus. So under norovirus genus comes your Norwalk virus, and sapovirus genus comes your Sapporo-like viruses. Okay, so both of these viruses, they are icosahedral. They are 27 to 40 nanometer in size. They possess a cup-like depression on the capsule surface, typically observed under electron microscope through your immunoelectron microscopy, which we are going to see in the next slide. Okay, then other than that, they are single-stranded RNAs, which only have one major structural protein. Okay, now Norwalk virus is the most important cause of epidemic viral gastroenteritis in adults, and sapovirus causes sporadic cases and occasional outbreaks of diarrheal illness in infants, young children and elderlies. Okay, they don't cause it in adults. Lab diagnosis and treatment are similar to that of rotavirus. Only thing is here they are not cultivable. Okay, so this is your Norwalk virus. You can see the IEM or immunoelectron microscopy of the Norwalk virus, and this is your sapovirus electron microscopy. So it is very hard to differentiate, but if you see like all the virus again and again, you will get that skills to differentiate between one virus and other by just looking into this immunoelectron microscopy. Now we come to adenovirus, which is the second most important cause of viral diarrhea in infants and younger children worldwide. So 2 to 12% of all diarrheal episodes in young children is caused by adenoviruses. So there are 2 types, type 40 and type 41. So details of which is already been discussed by you in the previous classes, so I'm not going into it. Okay. Then there is astrovirus, which as the name suggests, astro, it has a distinctive star-like morphology under electron microscope. So this is your star-like morphology is there. Okay, so that's why it is known as astroviruses, and the size here is they are a bit bigger, 28 to 30 nanometer in size, with icosahedral symmetry, and contains a positive sense single strand RNA. they have at least 7 serotypes, out of which serotype 1 is the most common one, and it causes sporadic cases and occasional outbreaks of diarrhea in infants, young children, and in elderly. Okay, similar to that of sapovirus. Then other respiratory viruses are your then other respiratory virus also may cause causes diarrhea, which includes your first of all is your this coronavirus, SARS coronavirus. Then is your then influenza A virus, which is your H5N1 virus. Then influenza A 2009 pandemic strain, which is your H1N1. And then there is 2 other viruses which are not that much important and not causes gastroenteritis in human so much. It causes diarrhea in a variety of animal, which are toroviruses and picoberna viruses. Okay, so these 2 are also under the viruses which causes viral diarrhea. Okay, so this is your coronavirus. This is how it looks like. Details of all these viruses have been taught to you. So this is your coronavirus. This is H1N1. This is your H5N1. H1N1 was your 2009 pandemic strain of influenza. This is your Toro, and this is your Picoberna virus. Okay. So thank you.